It worked. Yay.
Hello.
Hi. Nice to meet you.
Nice to
I'm
meet you as well.
Heather Step. And let me just check how to say your name.
Yeah,
Dr. Darren
Subrayan, yeah.
Subrayan. Subrayan.
Yes,
Okay.
yes.
Got it. Okay. Okay, I'm just going to read some information
Okay,
about you in
cool.
case people don't know, if you don't mind.
No, go
So,
for it.
Dr. Darren Subrayan is a registered chiropractor and the founding member of Danefern Chiro in South Africa. With over 10 years experience in chiropractic care, he takes a holistic approach to patient wellness, focusing on ergonomics, posture, and optional desk setups to improve spinal health and overall well-being. I'm not going to read all this list of education qualifications, okay?
Yes.
But what I found really interesting is that you spent 5 years in banking, which gave you first-hand experience of sitting at a
Hmm.
desk, you know. So I think a lot of people
Definitely.
can relate to
Yeah.
that. So this background has fueled his passion for providing long-term solutions to spinal health issues rather than temporary relief. Okay, and a lot of industry recognition rewards in that you won the Chiropractic Clinic of the Year, shortlisted for the African Excellence Awards, and one of South Africa's most followed chiropractors on social media, TikTok and Instagram. I found that very interesting because I'm sure there's a lot of content creators out there that'll be watching, so that's very cool. So welcome, and can you tell me a little bit more about yourself and how you actually switched from banking to being a chiropractor? What inspired the change? Tell me a little bit about that.
So I've got a really interesting story when it comes to my corporate sort of career. But I think the first thing is I did study chiro first, and then after that decided to pursue an MBA. I came from a family of MBA business graduates and MBA professors, and so I was very interested in the business side of medical as well. And so after doing that, I expected that I would use a lot of that stuff towards the practice that I was running at the time, but an opportunity just sort of came up to move into finance, and it was an amazing opportunity because I got to learn so much through the years. So I spent 6 years in corporate in finance. I spent a lot of time sitting at desks, spent lots of hours with neck and shoulder issues, even though I'm a chiro myself. And
Mhm.
so I learned a lot about how people, sometimes in corporate have to struggle through, suffer with pain. In fact, it was quite funny. I would treat a lot of patients, or not patients, colleagues of mine in one of the
Mhm.
meeting rooms when they were struggling with back issues. So I grew up
Mhm.
around a lot of that. And then I think after that, I decided that I wanted to get back to what my calling was, which is helping patients and doing what I do on a daily basis. And so I left the corporate world and went back into running my own practice. And what's been good though is a lot of what I learned in corporate I've brought across. So understanding how individuals in corporate work, bringing in a lot of stuff that we've used in our practice in helping our patients. So it's definitely been beneficial, but it also helps me understand, I think, very well what's going on with people on a daily basis, particularly in places like Joburg or Cape Town or Durban, big cities where guys have jobs that require a lot of time and a lot of stress. So yeah, that's my story.
Okay, sure. Okay, cool. There's a lot of people that are very nervous about going
Uh,
to a chiropractor. I'll tell you a personal story. My mom's sister was a hairdresser, and she went to a chiropractor and actually messed her up. So she never went back to hairdressing.
yeah.
But I myself have been, right. I had the shoulder issues, and the year before last, I went for a few sessions, and it helped me in that I'm not in pain anymore. I will say it's not completely gone though.
Yeah.
Yeah, it's not
No,
completely gone.
no, it won't after a
Yeah,
short
but
period
there's
of
a
time.
lot of people that are nervous, that have had the bad experiences. How do you sort of counteract that?
So look, I think the thing for me is that in all interventions there is a risk of some kind of negative effect. So whether that be taking a medication, going for surgery, there's a lot of things that can sort of go wrong. The thing that I talk about with patients is that usually the way that you want to mitigate that or build confidence in individuals is by doing the right checks, the right level of assessment, and looking for any risk factors or red flags. So when I work with a patient, I spend an hour with them before we start treatment, just getting an understanding of them as an individual, looking at if there's any risk factors, if there's anything that could be going on that could be a risk for me treating them. And
Mm,
then we make a decision about the plan. So there are some patients who come to me and I say, look, we are not going to be doing adjustments on you because you have this risk factor, that risk factor. And as a result of that, it may be more complicated. So we need to modify the way we treat you. So what I would say is if you have someone who does a proper assessment of the individual, that can help quite a lot in terms of that.
So it's coming from the beginning. If you've done the groundwork, there's less risk. Okay, cool.
Exactly.
So we're actually here today to talk about the World Health Organization, who recently released some guidelines on non-surgical back pain management. So I'd like to talk about those particular points. One being exercise and physical therapy. There's a lot of my audience are moms, right? They're very busy and, with kids and whatnot. How can they incorporate movement into their daily routines, specifically for back pain?
Yeah. So what I generally recommend with this is try and do activities with your kiddies or your baby. And in doing that, it actually becomes beneficial in two ways. So you get your exercise in, but also you get to spend more time bonding with your kids. And also the both of you have a better time. So I usually say to young moms who have babies, do a lot of walking. You can put the baby in a stroller and walk around. If you live in an estate or you live in a safe area, do walks around. And for me, walking is probably the number one recommendation for anyone who has back issues, in that it is a gentle movement. It allows the body to move gently without causing too much stress on the body, but at the same time, it's really, really good for strengthening. So what I usually recommend is try and do more activities using or with your baby or with your kitty. And as a result of that, then it doesn't feel as much like exercise, and you don't need to find that time in the diary, because what that then means is that you're doing something with them. So you don't have to find half an hour where they're asleep or half an hour when, they may be in daycare or whatever it may be. So for me, that is probably what I would say, is try and find a way to do activities with your kiddies, which makes life a little bit easier.
And I can certainly attest to the walking. And I know when my kid is a lot older now, he's 12, but when Nikki was small and in Australia, we actually had a walking moms group, and we'd do it together. It becomes a social thing as well,
Yes,
which is quite
definitely,
cool.
definitely. Yes.
Yeah. Okay, self-care and education. What strategies do you recommend for preventing back pain, right? Is there anything that we can do to prevent it?
So I think the important thing is that prevention of back pain comes from a healthy lifestyle for a long period of time. So usually what happens is that when we start to neglect our health in terms of looking after ourselves, also can be stress, mental health, things like this, we start to see that back pain then can pop up. And so what I would generally say is that in terms of self-care, the important thing is to maintain some level of physical activity, whether that be walking or some form of exercise, not just for the physical attributes, but also for the mental and stress reduction attributes that come from that. I think also in terms of self-care, a lot of moms that I see in practice come to me and they've usually neglected something or left it for a very long time. So they will come to me and say, I've had this for 3 months. And I always tell them is it's better to address something in the intro or the beginning than it is to let that fester and become a bigger issue. And it becomes a long and arduous process to fix it.
I think you're so right, and I mean, it's something like I had this problem since when Nikki was born, and I didn't do anything with it.
It's a typical story, but the important thing is that, and I understand it, because obviously you've got a new baby. There's so much emphasis placed on the baby and looking after the kids and all of that. Often they neglect themselves. They say, look, I'll sort this out next month. I'll worry about this when I get time. But what you also need to realize is that if you are not at 100%, how do you give back? And it's that case with mothers. It's the case with me as a practitioner as well. If I'm not in a good place looking after myself, how can I give 100% to my patients? So it's a similar concept in that you need to, prioritize yourself to some degree. And sometimes that might sound counterintuitive, but it actually is sometimes more important for an individual.
Yeah, no, I hear you. Okay, mental well-being and stress management. How do you address the mental and emotional challenges that come with chronic back pain? So this is someone that does have it a lot and is living with it. And, it is, emotionally draining. How do you give them some tips to cope with that?
So look, I think the first thing is you need to understand the problem. So different individuals will deal with different situations differently. And so we need to come up with plans that address the individual, but we also need to see what's capable for each individual. So some individuals, stress reduction techniques that I talk about are things like, for instance, deep breathing. So I might say that when you do get a chance before you go to bed for 5 to 10 minutes, put some classical music on or some calm, relaxing music, and do controlled deep breathing just to calm the system. Now, that may be a very simple thing for someone, but it may be quite complicated for others. That can also then build up to other things. So, for instance, there are activities that people do that de-stress them. Some people love yoga or Pilates or going to the gym. So it really does depend on the individual, what they may have done before, what works well for them, and what maybe doesn't work well for them. So I wouldn't say that there's a blanket approach. I usually sit down with patients and discuss a lot of different opportunities or options in terms of how we can decrease stress levels. And we see which ones work, and maybe sometimes we even try it out. So we say, let's try this for a week. Let's see how it goes. Come back to me when you see me next week. Let's talk about it. And they may come back and say that was brilliant, or they may come back and say, listen, you know what, I don't think I can stick with that. And then we try and modify it as we go. So it really is tailored to the individual. But I would say for the general public out there, start with things like deep breathing. If you get into things like meditation, that's also great. Relaxation stuff, doing activities that you love. Some people love reading, some people love walking, some people love gymming. So find the activity where you get joy from and try and do it a little bit more. And that generally helps a lot with mental health as well.
Yeah. No, I think that's such good advice, to find the thing that brings you joy and filled your cup, because that's also going to help and make time for us. Yeah. Okay, then reducing over medication. What are your ideas on this to stay updated on, ways of treating back pain without relying on medication, but just in general, it is very, in our culture, oh, I've got this problem, I'll just take a pill. How do we actually reduce that pill mentality as well?
So I think, look, there's a couple of things. There's a mentality and sort of like a structural component, which is there's a typical thing that if you have a pain, you take a medication, right? The other thing is that people generally will only take a medication when they're in pain. So you're not going to find people regularly taking pain meds when they're feeling great. So the first thing I usually look at with patients is when they come to see me and they're on meds all the time and have been for years, I always tell them, let's not focus so much on decreasing the meds immediately. Let's see if there's ways to improve your pain levels. Let's get you stronger. Let's get the pain to drop. And I can tell you that most patients, when that happens, will stop taking the meds. So in terms of medication, we know that there's a lot of adverse effects related to it. There's overdose, there's addiction, and there's a lot of other effects on your organs of the body. So we know that it's not good, but people take it because they feel that there isn't another option. With these WHO guidelines, the big thing that comes out of it is that there are options, and we need to look at different forms of helping individuals, whether that be educating them, exercising more, finding the problem and figuring out long-term solutions to address it. These are all ways that we can cause the pain levels to decrease, and then people are not going to be as reliant on the pain medication. So for me, it's almost like a chicken and an egg scenario. Let's fix the pain, and you're not going to want to take the tablets. But if you're always in pain, you're always going to want those tablets. So we have to actually get to the root cause, fix that, and then you'll stop needing the tablets or the pain medication as much.
Yeah, I hear you. Yeah, if you actually fix it, then you don't need the meds anymore. Can you share how you approach designing a treatment plan that combines physical therapy, self-care, and stress management? And that's quite a large question, but I understand that you want to attack this thing from all angles. Yeah.
So I think, as you say, it's a question I could spend a week explaining. But what I would say is the first thing is I need to understand the individual and where their problems are. If their deficits are in education, they don't know what they're doing that actually makes the problem worse, or they don't know what their problem is, we need to focus on that more. But in general, what I would say is self-care is about understanding the behaviors that you do on a daily basis, which may be aggravating your back issue or your issue. In terms of education, education is about first understanding your problem and then understanding what changes that you can make to improve the issue so that your problem is less, hopefully in the future. And all of these sort of, with the mental health as well, all sort of linked to each other. So every patient that I work with, for instance, we need to offer them a solution that incorporates all of these. Because what I've found is that when I just treat it, and I would treat a patient and just say, okay, cool, come and see me next week. What we find is that usually they'd say, look, I felt really good after a session, but 2-3 days later, it sort of came back. And usually what I found after that is if I did a lot of analysis and understood what they were doing in that week that may have caused the issue, what we found is that if we could modify those behaviors, we actually got a longer lasting or even a long lasting solution. So for me, designing these plans is very customized. It's almost like a tailored suit compared to buying something off the rack. And it needs to be specific to your specific needs and
Are
your
you
specific
giving
problem.
them, sorry to interrupt, are you giving them like exercises that they have to do or telling them not to do certain things that
Correct.
are causing a problem or
All
something
of
like
that.
that? Okay.
All of the
Uh-huh.
above. So when I work with a patient who has an issue, first thing we'll talk about are, after I've assessed them, we'll basically work out what type of behaviors or positions aggravate their body. So it may be leaning forward, it may be picking up stuff, it may be sitting for too long. And we want to modify each of those behaviors. So some of them we may eliminate completely, some of them we may modify. So say, okay, when you're sitting, don't sit leaning back or don't slouch, sit in this position. And those will be specific to that individual. And then what we'll want to do is we'll want to strengthen the body as well. So we're going to start them with gentle stuff, and we want to, over a period of time, incrementally build them up, just like you would if you go to the gym and you want to build up big muscles. You're not going to do that in a week. You're going to build it up slowly, 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 and eventually you'll get to a level where you feel strong. It's a similar principle, is that I look at your back in the same way as people who look at their bicep or their chest. You can build this up over time and you can strengthen it, but you also need to, when you're training, stay away from bad behaviors when you're training, stay away from bad form when you're training, not train too much and not train too little. So these are all sort of factors that we have to juggle when we're coming up with a plan.
Okay, sure. All right. Some of the cases that you get, you might find you need, a doctor or maybe more other specialists. I actually got a question, which I thought I would actually incorporate with this, okay, from one of my people that responded to my newsletter. She says, if there is backache, could there be an organ that is the actual problem and not necessarily the back? For example, a colon-related problem presenting it as a backache. I'm not sure what you think about that, and I know you're not a doctor, but I don't know if you've got any
So we
input
learn
on
about
that.
this a lot. So one of the things that we learn about when we study, because chiropractors study for a while, so we study for 6 years to be a chiro, but one of the things we talk about and learn about is something called referred pain. So referred pain means that you're experiencing pain in an area that's distant to where the cause of the pain is. So an example, if people have, for instance, a heart attack, they may not only experience pain in the heart, but they may get pain down the arm or up the neck. That's what we would consider referred pain. Now, in terms of the spine and the back, there are multiple areas that may experience referred pain. So a person may, for instance, have a kidney issue, and that kidney issue may present as back pain or lower back pain, even radiating down into the groin. So this is a case where it is possible. What I would say to that is that that's why it's even more important that you get checked by a professional up first. Because what I've noticed is I've had a few cases like this in my practice where an individual's come through and they have back pain, but when we assess them, we notice that this doesn't seem to really fit into the typical pattern. And usually we might treat them once or twice and then see, oh, look, this isn't really responding, and we might need to refer you to the GP or to a specialist. And we do pick up in some cases that it would have been a kidney stone or a kidney issue, and that's why they're feeling pain. So it is possible. It doesn't happen, I would say, that often, but it definitely is possible that you could have an issue in one area and you're feeling it in the back. But it's not actually a mechanical issue of the spine. It's more an issue of an organ being inflamed or injured or something. So it's definitely possible, yes.
Okay. All right. Interesting. Yeah. Okay. Can you describe maybe a case study where you helped a patient improve their mobility while managing chronic pain? Maybe like an example.
Okay.
Yeah.
So look, it's a hard one to list one because that's what I do every day. But I think there's some good stories that we've had is like, for instance, patients who come to me and said, look, I've got my daughter getting married in a week or two, and I am really struggling. My back is really bad. I'm unable to walk, and I want to walk them down the aisle. And we have to do work to try and help them. And we've been very fortunate with some of those cases to be able to help them and be able to get them to a place where they're able to do what they want to do in terms of lifestyle and in terms of quality of life.
Yeah,
But
that's
what I would say is that's generally what we do. So pretty much every day, what I do is I see people who are in some way struggling, not just from a pain perspective, but from a lifestyle perspective. There's things they can't do now that they were able to do last year or whenever it was. And we work with them to get them back to that. One of the questions I ask in my assessment is, tell me what you want to get back that you can't do now. So someone may say, look, I used to be a runner and I would really love to be able to run, even if it's running 1 kilometer. And right now I can barely run it at all. And we work at those goals. So we might set that as a goal and then we work towards it and we build towards it. So for me, that's a very important thing, is what are the lifestyle goals that you have? So we've had a lot of great stories, but I mean, that's every day. It's an everyday thing. So it's hard to list one. That's probably the one that stands out, the wedding, but that is pretty much what we do every day.
But that is so rewarding, hey? That you just know that you've done something special for that guy and you can share in their special day. And it's so cool.
Yeah, it's very cool.
Yeah. Okay, and then I've got some more questions from people. Okay, I'm not actually sure because this might be more like a doctor territory, but maybe you could just give your opinion. Okay, so this one, she says, I'm 53. I have low back pain that I could tolerate, probably because I have a high pain threshold. But some days I take Corexib or generic Ecas, or I don't know how to pronounce these C's, 30 milligrams, only maximum 2 days. Then rather see my doctor on the 3rd, especially after sweeping around the yard or in my home. Should I be concerned?
Okay, so what I would say in this one is, first step is, what I would do from my perspective is look at it. First thing, from what I can tell, the fact that it is not very severe pain and it happens related to specific activities tells me that it's more what we would consider a chronic back issue. It isn't something that I would generally say is incredibly severe and needs to go to a surgeon or a doctor immediately. So that's the first thing I would say. The next thing I picked up in this is that it seems to be related to activity, so sweeping. So what I would generally say if I were sitting down with this patient, obviously after having done a full assessment, is we need to either decrease the amount of sweeping or change the way you do this activity. Because if you can find a correlation between this causes my back to get worse, why don't we get in front of that and eliminate the first 2 days of
I know. I know. I know, my internet. I know. Or is it his? Or is it? Or maybe it's his. Going to. Okay, we're just waiting. Technical problems, guys. It happens.
Hello.
Sorry. I don't know if it was you or me, but technical
I don't know.
problems.
All right, we're back in business though. That's
We're
fine.
back in business. Okay, anything more?
I don't know where we cut off in that process, so let me just go through it again, basically. So I think in that case, the first thing I would talk about is it seems like there's a correlation. So when she
You
sweeps
said
or
the
does
movement. She
the
needs to
movement,
change the movement.
correct. So if I were working with her, the first thing I'd do is obviously we do a full assessment, but one of the things I would focus on is, okay, if sweeping is the aggravating factor, we need to make a change there. So it may mean that we need to either stop sweeping, we need to change the way you sweep, we need to change the amount of time you sweep for. These are multiple factors that we play around with around sweeping. If we do that, the hope is that we don't actually start the cycle. So we don't start the day one of being sore, having to take pain meds, the day two, and then eventually it building towards going to see the doctor. So for me, what I would say is number one is modification of behaviors that cause pain. Next thing you'd want to focus on is strengthening the body. So that if someone is getting pain when sweeping, you know that their back and have had a chronic back issue, you know that their back is most likely weak. So you're going to want to focus on strengthening their body. So you're going to be asking them to do certain activities or behaviors or strengthening in specific ways. So walking is a good example, and then there'd be specific core strengthening and things like that. So this would be how I would generally approach a case like this. There'd also be treatment components to it to take pressure off the areas and strengthen the areas, and also make the person feel less pain in the area. But for me, whenever I look at a case like this, I always say, let's figure out why your back is sort of crying. I always view pain as your body complaining or shouting at you. And most people just ignore the shouting until it gets so bad that it's debilitating. But if a person is quite aware and listens to their body a lot, what we find is that they usually come in to me and say, listen, when I do this, 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 and this, I know that it aggravates my back, but when I do this, this, and this, it's fine. So then we say, okay, let's do more of the things that are good for your back, and let's see if we can eliminate or modify the things that aggravate. And generally what we find then is that they see their pain levels drop significantly within a week or two, just by changing the way they do certain things or not doing certain things. So for me, that's what I would focus on in this case.
So interesting. Okay. And then the same person, she said, for many years I developed pain from mild to random stabbing on my shoulders, especially if I've been in a cold draft and did not or could not place a jersey or scarf over them at the time. Is this cervical spondylosis connected?
Yes.
Or possibly the neck area? Okay.
So let's start at the beginning with what is cervical spondylosis. So cervical spondylosis is a degeneration or wear and tear in the neck, or whichever area, neck, lower back, wherever it may be. And cervical spondylosis refers to the neck. And what this then leads to is it means that the discs or the shock absorbers in the neck are not working as well. They've lost their ability to do their work efficiently. And that means that it puts more pressure on the joints, the bones, and also the muscles in the area. So in a person who has this, they may have more stiffness in their neck generally. As a result of that, those muscles are now working harder. Because the muscles are trying to stabilize and protect the neck, they're actually doing more work on a daily basis than they are designed to do. So then when a cold draft comes, which usually causes the muscles to stiffen up and tighten up more, that almost sets off the trigger, which causes the system then to collapse. And that's when they experience the pain. So in a patient like this, again, we know that there's a cause, and that is related to, for instance, the cold weather. We know that that person needs to be extra cautious of being in cold situations. So a person like that, I would recommend make sure that you travel wherever you go with a scarf or a jacket, something that you can keep over the neck. The second you sense anything that's even close to a discomfort in your neck, you're going to want to zip it up. You want to keep it nice and warm. So that's one way that we can help prevent the cycle beginning. In the long term, that person is going to most likely need therapy or treatment, and is most likely going to need to strengthen the muscles that are supporting their neck, because right now those muscles are exhausted, they're tired, they're stiff, and they're not able to do the job. But if we can do the right type of training, rehabilitation, and strengthening, they may be able to tolerate more, and they may not give as much issue. So in that case, that's what I would focus on in terms of how we'd approach it at the beginning, and obviously you tweak it as you go forward.
Okay. Then on Instagram, I had someone that asked about the correct desk posture. She's actually a teacher, but I mean, we all sit at desks at some point. So she's having neck pain, but yeah, can you give us some tips about?
So this is something I do with every patient. So every patient who works at a corporate generally sits for their job, usually will send me pictures of them seated from the side view, from behind, and usually from an angle, so I can see what's going on with their desk. And there's a couple of things that you want to focus on. So the first thing that I usually pick up with most people when it comes to sitting is that they generally have a bad position in terms of where their neck and shoulders are. So let me do this side on so you can see. It'll be easier this way. So if you look at most people when they're seated, they generally are seated not upright like this and looking this way. They generally are here and looking down at a computer or a screen. As a result of that, there's a lot of buildup of pressure in the neck and the shoulder area, and that becomes stiff and tight over time. So the first thing that I generally recommend to patients is increase the height of your screen. So instead of having your screens looking down at a laptop, looking down here, this angle, what you're going to want to do is you want to increase your screen so that you're looking eye level. So you're looking at the horizon straight ahead. And if you're looking at the horizon straight ahead, what that does is it forces your ears back in line with your shoulders, and it pulls your shoulders further back so your chest is open. This is a more what we call a neutral position or natural position for the body. In addition to that, I generally find that patients are usually quite leaned forward. So they're working like this with their lower back quite rounded and flat and leaning forward. And what I generally recommend for patients in that situation is that they take a heat pack beanbag or a pillow or a cushion and place it into the lower back area so that it pins them more upright. By doing that, what it does is it actually forces you to be in what we consider or call a neutral spine. What that is the most efficient way for us to hold ourselves, which distributes the pressure through the spine better and doesn't cause specific areas to build up in pressure or pain. So those are the
Actually, I
typical
want to show
things.
you my. This is my. I don't know if you can.
Yeah, let's see your desk setup, then I can give you some advice.
Yeah, but look, this is. I've got it elevated. I've got like a desk stand. Can you
Yes.
see? Yeah.
So what I would say is that's good in a lot of cases with a lot of patients, but usually what I find with people with that is that it might not be elevated enough. So I find that a
Okay.
lot of people who elevate it, they'll elevate it a bit, but now they're looking, instead of looking straight down at the table, they might be looking here. But what I want you doing is I want you looking there. So it should be almost
Yeah.
straight ahead and you're looking at the horizon basically. I want you looking at that level. And if you do that, what you find is generally that takes a lot of pressure off the back of the neck and the shoulders, and that can help. Another thing with sitting is how long you sit for. So this is a big thing.
Oh,
You can have the perfect desk setup, but if you're not taking regular breaks, if you're not getting up and moving around, that is creating an issue as well. So I generally say, depending on the type of job you do, I have some patients who work 12 hours nonstop at a desk. And I tell them every hour you're going to get up regularly. You're going to be the person in the office who has a weak bladder, the person in the office who needs to have coffee every hour, and get up and move around. They don't need to know why you're walking around all the time, but you are actually preventing issue, you're repairing your back, and you actually helping it heal. So those are things that I would definitely say are important when it
Yeah.
comes to not only the posture, but behaviors, or I call it back hygiene, the hygiene factors of what you do on a daily basis, if that is your job.
I think, I'm teaching, but I do have breaks in between. But yeah, I notice, if I ever have to do 4 hours in a row, that is a bit rough.
So the simplest way to do that is to set a time on your phone. So when I work with corporate people, they'll tell me, look, I'm always busy on this and that. And I say, okay, cool. On your phone, set an hourly alarm and do that for the first week or two. And it is a bit of a nuisance at the beginning because you're like, oh, you know what, this is a bit of a, like I'm in the middle of something, I'm in this project, I'm in that. But what we generally find is that if you do that for a week or two, even sometimes maybe a little longer, it becomes a natural behavior for you. And after 50 minutes or so, you start actually saying, flip, I need to get up and I need to move because I'm so used to doing it. So for me, all of our behaviors can be learned, unlearned, and good behaviors can be learned and bad behaviors can be changed as well.
Yeah, no, absolutely. Okay. Can you give an example of a simple stretch that our moms can do out there? Just something that's going to be good for the back, something simple that we can do.
Yeah. So most new moms definitely are dealing with a lot of neck and shoulder issues. Usually that comes from a few reasons. You're carrying the baby a lot, breastfeeding, things like that. So that can put a lot of pressure on the neck and the shoulders. What I would say to you in terms of stretching is you want to do something very simple, gentle, and not something that puts too much pressure on the area. You don't want to aggravate it further. So what I would say usually is a simple stretch that you can do is what I call the yes, no, maybe sort of a stretch. So what that means is you are going to do the movements of yes, no, and maybe. I'll show you what that looks like. And you're going to do that to mobilize or move the joints of your neck. So in terms of yes, when you say yes to a person, you say yes by doing this. So when we do a yes stretch, we're going to go as far back as we can go there, and we're going to go as far down as we can go chin to chest. And we're going to do it very gently like I'm doing here. This isn't something where you're going to jerk it forward and really force it. You're going to allow the body to go to the level that it's comfortable with, and you're going to slowly increase that. You may do 4 or 5 ups and downs, and that would be yes. When you say no to someone, you usually shake your head side to side. So the no would be completely over to the side, gently going there, going over to the side here, and doing that 4 to 5 times. The idea then is we are gently mobilizing the joints, gently stretching the muscles and not forcing anything too hard, but allowing the body to naturally allow us to go a little bit further each time, and even every day or every few days building it up. The maybe one is going to be ear to shoulder, ear to shoulder. So you're going to be going to ear towards the shoulder, ear towards that shoulder, and you're going to be going there. And as you do that, you'll feel that it stretches out over there. And as you go this way, you'll see that it stretches out over there as well. So these yes, no, maybes can be done once a day. And generally what we want is I don't want you to feel pain while you're doing it. I want you to do it in a very relaxed, calm sort of way, and that it needs to be not jerked and forced. It needs to be very gently pushed to the end ranges of motion. And the other thing you want to do is you want to slowly build that up. So you want to see whether you can do that more often and if you can get more mobility from it. as with anything, if you're doing it and it makes the pain worse, then you need to stop, and you probably need to be assessed by someone who can give you good advice as to why that may be happening or what else you can maybe do. But
Okay.
for me, that is a very, very simple thing that I recommend to most patients who work in front of the desk, is just do a couple of those in the day if you're sitting for long hours, and you'll generally find that your neck and shoulder muscles don't get as stiff. The other thing I love recommending is a heat pack, beanbag, hot water bottle. So any heat therapy is really good for muscle tightness. So if you have a weak bag, you warm it, you place it over the neck and shoulders, 15 minutes, 2 to 3 times a day. And that also works really well for stiff tight
Yeah,
necks
no,
and shoulders.
I've got one of those. It really does
It's
help.
my favorite thing to recommend in the practice for patients.
Okay, any final thoughts to motivate people to do these exercises and look after themselves?
So I think specifically for new mothers, having become a parent, I have an 18-month-old now. Having become a parent, I think
Wow.
I have a lot more appreciation for how difficult and what a challenge, as rewarding as it is, what a challenge it is to be a mom. And one of the things I notice when I treat moms is that I see a lot of moms who neglect their own health and happiness, I suppose, to some degree in terms of physical health, to make sure that their baby is doing well. And what I say, as I said it before, it's very important that you focus on making sure that you're in a good place as well, because then you can give so much more to your kid. So for any of the mothers out there or individuals out there who are already struggling with these type of issues, what I would say is try and focus on doing things to help improve yourself, because when you are at 100%, you can give so much more than if you're at 50%. So I hope that all of you out there, if you are struggling with back issues or really struggling and have been struggling for a while, go and find someone who can help you, give you advice, come up with a proper plan, not just say, look, I'm going to treat you for 4 sessions and that's going to be the solution. How are we going to address this? Where's it coming from? What can you do? What are the things you can do? What are the things I can do? And what do you need to strengthen? And I see in patients and in practice every day that when you have this sort of holistic or multifaceted approach, we get far better results than if we just do treatment and you come back every week or whatever it is. So that's all I have to say.
Sure. No, thank you so much, Dr. Darren.
Yeah.
And thank you for your time as well. I
No.
do appreciate it. And I know we all learned something today.
I'm glad you guys enjoy. And yeah, if you ever need anything, anyone has any questions, you guys can contact us anytime. We post a lot of content on social media for educating people about back issues. So if you are interested in anything, you need to contact us. We're always around.
Yeah, I'm going to look you up. I didn't realize you're on TikTok as well. So it's the same handle, Dane
Yes.
Fern Cairo. Okay, no, that's cool. Okay, we'll check you out. Thank you
Thank you.
so much.
Have a good one. All the
Bye.
best. Cheers. Bye bye.